Fraud, waste, and abuse in Medicare. What is Medicare? Medicare is a federal program that provides insurance to people ages 65 and older, people with disabilities, or with end-stage renal disease. The program is composed of Parts A, B, C, and D. Part A covers hospital visits, Part B covers physician services, Part C combines Part A and B, and Part D covers prescription medications.
What is fraud, waste, and abuse? Some examples include Medicare billed by a healthcare provider for services a patient never received, Medicare billed by a supplier for equipment a patient never received, someone other than the patient using their Medicare card to get care, supplies, or equipment, and a person joining Medicare plan because they are given false and/or misleading information. Providers, pharmacists, and patients play key roles in Medicare Part D fraud, waste, and abuse. Each case is different. Each player can be the victim or the criminal. Why is it a problem? Fraud and abuse in Medicare wastes a lot of money. This waste of money results in the rising of healthcare costs and taxes. In 2009, the Institute of Medicine estimated $750 billion wasted due to fraud, which is roughly 30% of the healthcare spending. To ensure Medicare exists for future beneficiaries, such as the baby boomers, lowering wasteful spending should be enforced, along with promotion for better health outcomes at lower costs.
To combat those problems, there are policies already in place. Some include the Healthcare Fraud Statute, which prohibits knowingly defrauding a healthcare program. Knowingly is defined as not only actual knowledge, but also deliberate ignorance or reckless disregard of the truth or falsity of information. Also, the False Claims Act states deliberately presenting a false claim and/or using false records or statements to obtain a payment on the claim is unlawful. Lastly, the Anti-Kickback Statute prohibits knowingly and willfully offering, paying, soliciting, or receiving remuneration in order to induce or reward businesses payable under Medicare. Breaking any of the previously stated policies can lead to penalties which include monetary fines ranging from $11,000 to $250,000, 5 to 10 years in prison depending on severity of crime, and exclusion from Medicare and other federal health care programs.
There are some possible solutions to be put in place. As of now, reporting potential fraudulent claims is not a requirement for healthcare workers, but should be turned into a law to reduce fraud, waste, and abuse. Also, by increasing the grace period for payments from 14 days so more time is allowed to investigate cases. Instituting a national database all healthcare providers can access to verify accuracy of a patient history and information may help curb the problems we face today. In conclusion, the Medicare program was created to essentially assist the public with the high cost of healthcare and has helped millions of people across the nation. While the majority of Medicare population depends on this program, others are unfairly and unlawfully finding ways to take advantage of its services. Overall, there is potential for improvement in existing Medicare prevention programs, policies, and guidelines, but continuous advancement of these tools as well as the promotion of new regulations can make certain Medicare will still be available for our future generations.